Next up, we have our first panel discussion on prevailing established healthcare international standards and national policies that can make immediate impact. It is indeed an honor for me to introduce our renowned panelists, and as always, let me start with our respected moderator, Dr. Dari Alhuwail, Associate Professor, Information Science Department at Kuwait University and Regional VP MENAHIA at International Medical Informatics Association, Professor Samara Ahmed Amer, Associate Professor of Public Health and Community Medicine, Egypt, and Scientific Consultant, Ministry of Health, Saudi Arabia. Dr. James Laughton, Head of Clinical Governance, Risk Management, and Quality Improvement, Hamad Medical Corporation Ambulance Service Group. Dr. Syed Mohamed Aljunid, Professor of Health Economics, Policy and Management, Kuwait University. Dr. Rajesh Rajan, Cardiologist at Al Amiri Hospital, Ministry of Health, Kuwait. The stage is all yours, Dr. Dari, to moderate this wonderful panel on a very, very timely panel discussion topic. Over to you.
Thank you. So hopefully everybody can hear me. I'm outdoors right now in the beautiful city of Kyoto, Japan. This tells us the power of technology, right? And how we can be all very much connected no matter where we are, right? Having this conference is one thing, and having it and doing it online, and no pun intended here, right? While we do things online for a telehealth conference is very, very smart. So thank you for the conference organizers for allowing me this opportunity to really be amongst, champions and stars in the region that are really doing amazing things. And prior to just jumping, I just wanted to share with you and set up the stage in terms of my own personal thoughts when it comes to the topic of having the international standards and national policies that can make immediate impact when it comes to telehealth adoption. So we heard Professor Abdul Hamid explain to us the benefits, the value, and share his views on how and why telehealth is important. He also shared with us, the case of Qatar and as well as the rest of the GCC and how this makes sense. To me, I feel sometimes, especially in the Gulf region, maybe we get super excited about the technology, and some people say all, but some people that we throw a lot of money at a problem and then it would get solved. But that's one issue. But we really need to have an enabling ecosystem, right, for anything to be successful, whether that's the infrastructure, whether that's the human capital, or what we're going to be talking about more today, the standards, right? So that's very important. Now, it also should consider, whatever standards, policies that we apply or decide to, if you will, hold ourselves to, we need to be considerate of our culture, as well as the various populations, and some countries within the GCC may have transient populations that have specific needs, and we need to address that. This process should be mindful. It should be have it start by design from the start, from the get-go, and not an after fact. Also, telehealth services really should complement and support healthcare providers and not burden them. The last thing we want to do is overwhelm our healthcare frontline staff and actually burdening them with many things that they shouldn't be necessarily bothered with. And then lastly, and I'll end here with this last point, that we need to be inclusive. We should not leave no one behind. So as an example, the WHO and the ITU issued a standard, right, for how we can be inclusive of all people with special needs. And they list a bunch of recommendations, and I urge everybody really to look at this fantastic document and really sort of reflect and review about what's happening, if you will, on the ground in your particular facility or your particular country. So with that said, this was my hopefully very humble, brief introduction, and hopefully we can stick on time because I have a train to catch. But I'd like to start with my colleague, Professor Syed Aljunid, who's the chair of the Health Policy and Management at the College of Public Health at Kuwait University. So, Professor, if you can actually shed some light and explain maybe to the audience that had joined us, what's the role of telehealth in achieving the health system objectives?
Yeah, thank you, Dr. Dari, for uh, for facilitating this discussion. I want to just review the objective of the health system. There are four main objectives of any health system in the world. And the main objective basically is to achieve universal health coverage. There are four components regarding in terms of accessibility, making sure that the service is accessible to everyone, efficiency, providing value for money, quality, and also equity. The first objective regarding accessibility, there is a potential solution by telehealth where people who stays in remote area, for example, can easily be accessible if we have telehealth so that you don't have to come to the clinic that frequent. But these challenges of using technology to solve accessibility has not been proven in many countries, because in countries where people have a problem with accessibility, they also have problem with accessibility to the technology that we use in telehealth. Maybe in developed countries is a different story. Regarding efficiency, this is another issue. Most of the telehealth solution in many countries are very expensive, and government in many countries may not be able to actually afford this expensive technology in order to maintain it. Potentially, it can actually reduce the traveling time and also the cost from the patient side. But then to maintain the system might be very expensive, and this need a lot of resources. Quality of care, there are some studies which shows that quality of care can be improved because patient may be able to have access to the doctors easily and get proper treatment. But anyway, that is from the technical perspective. From the patient satisfaction, we have heard that the keynote address by Professor Samar just now, patient satisfaction may not be there because they cannot see face to face with the doctors, and that will limit the achievement of the quality objective. And the third one regarding equity, there's very few studies that shown that equity can be solved through telehealth because of the expensive and also the cost of the infrastructure. So these are the issues that we are seeing. There are some positive effect can be shown by telemedicine in healthcare objective, but there are a lot of challenges facing many countries in the world.
Fantastic. Thank you, Professor Syed. And now I'd like to invite Dr. James from the Ambulance Group of Clinical Governance at the Hamad Medical Corporation. So looking at all of what we heard from the keynote speaker and what Professor Syed had just alluded to, why is it the right time for us to consider having international standards and policies? So number one, why? But number two, then, what would be the first step in your opinion?
Okay, thank you very much, Dr. Dari. Thank you, everybody, and thank you for the invitation to speak here. And I'm very lucky that Professor Abu Samra opened with a keynote experience from Qatar, so I don't have to talk about that directly. So thank you. Equally, I also know Kyoto from many years ago. Beautiful city. I'm envious, and good luck catching your train. So in terms of the first step, let me just take a look from what is the framework we build on. We can have standards and policies, but maybe there's some more general approaches. And recently, I reviewed a book called Humanizing Healthcare, a doctor from the US called Samar. And one of the key things, and so relevant to telehealth, is the interaction between humans and technology. And this is exactly what we're talking about. It doesn't work any other way. And really, it's about people. And what I really took away from Dr. Summer's book is she talked about patients, clients, but one of the key things was the natural support network and the clinical team, but interacting with technology, and talked about these healthcare hubs, which were this interaction interface between the technology and people. So first of all, thinking about the humans in the system is important. The Institute for Healthcare Improvement have a white paper on telemedicine, And I always refer back to IHI. That's where I've received training from. And critically, and I'm going to getting to the point, they talk about co-design. And co-designing definitely in terms of with our patients, the people in the system, but clinical teams, ancillary staff. But building this with trust, importantly, human connection, because that's one of the biggest things we require as human beings, is that human connection, and that interaction with healthcare staff, humans, is so critical. Focusing on quality, safety, and person-centeredness for me becomes the sort of building block that we start on. Other things I think about: do healthcare professionals need new skills to deliver telehealth, telemedicine? Possibly, yes. We certainly need to know how to operate our cameras and our microphones, and I think we've all stumbled at times doing that. We also need to think about what education do patients and their families need, and that comes back to the co-design aspect. And I'll always talk about that very famous IHI question: what matters to you? But what matters to you, the patient, your family, but what matters to the clinical team, to the carers? And from there, we then need the policies and the standards to support that approach, to support the person-centered approach, to support us using things like model for improvement, process improvement, how we're going to improve what we do, and equally how we measure quality, safety, and effectiveness of telehealth. Thank you very much.
Wow, fantastic! Thank you, Dr. James. That's really a lot of interesting and very valuable good steps. Hopefully, we can start embarking on this journey. So I'd like to now invite Dr. Samar. Speaking about maybe the from Saudi Arabia, maybe talking through the great and fantastic achievements that have been happening, and what sort of national policies that had an immediate effect from your perspective that you'd like to share with us.
Okay, thank you. I'd like to thank all speakers and you for your nice invitation and the interesting topic at the beginning. Here in Saudi Arabia, it's a high-income country, and nowadays, according to the world classification of Saudi Arabia use and technology, Saudi Arabia rated by 38 place, and Riyadh especially considered the first Arabic digital country. More than 70% of all Saudi Arabia covered by free internet services. So, according to our vision 2030, especially after COVID, the population use of the technology have amazingly raised. The role of telemedicine and teletechnology is very interesting and have many immediate impact as regards many areas. First of all, in all aspects of life, as regarding Saudi Arabia was the first Arabic country in traffic accident 2013, and after the application of telehealth and teletechnology, now it's slowed down. Virtual hospitals now available with a very expert consultation team. They can provide ICU services and physician-to-physician consultation to overcome the disparities. So even at far areas, they can get through the virtual hospital an accurate and expert investigations. Even the patient right, the complaint, we have an online 937 and virtual consultation services. Our amazed finding was during the pandemic that by an SMS and the telecommunication, they have contact trace. Patients have restriction rules by an application. Everyone who didn't get the vaccination dose according to his age, he didn't allow to go any. So it's have an direct and great impact on the prevalence of on the incidence of COVID-19 spread in Saudi Arabia, even among school children after it's on. Nowadays, we use telehealth in the screening in the policy of the NCD's control program, interactive education messages tailored to every age group and to every disease. So anyone who has a certain chronic disease, he has a reminder and communicate with an expert through the telehealth to encourage him about health lifestyle, about the screening time. One of the best amazed and has direct effect the using of telehealth in Saudi Arabia is the premarital counseling. You know, Saudi Arabia, many of, according to their culture, they married the relatives. So the prevalence of inherited disease was high. Nowadays, by law and by policy, everyone who is unmatched and had a susceptibility to have a birth to a diseased infant, by law and telemedicine, they have a virtual message and virtual consultation, and so the prevalence of or the incidence of non-inherited diseases was manifestly reduced. Even so, the online file and electronic system all over the Saudi Arabia has an agreed and immediate effect in reporting and the follow up the prevalence of a lot of diseases and proper control per region. That's in brief and what go on as regard the policy and its immediate effect on our in Saudi Arabia from the telehealth point of view.
Great, fantastic. Thank you, Dr. Samar. And now I'd like to move to Dr. Rajesh. You know, as a clinician, you know, cardiologist working at Al Amiri Hospital, maybe if you can shed light about your own experience, the interactions, what's the situation on the ground when it comes to using and leveraging telehealth services in Kuwait?
Yeah, actually, it was entirely different when we compared pre-COVID and post-COVID era. Our center, Sabal Ahmed Cardiac Center in Al Amiri Hospital, this was the one among few centers in the world who, go on doing all kind of interventions as well as cardiac surgeries during the peak of COVID. I mean, from March end till today, we never closed our cath lab, we never closed our surgical labs. So we had teleconferencing among all the other hospitals, and we used to receive patients from different hospitals, and we continue the same. And this is possible only with the help of telehealth. So during this COVID era, the Kuwait healthcare system rose like anything. We developed so many medical apps for the patient, for the physicians, and we started consulting to the patients through this app. And development was massive. And till COVID, almost all the hospitals, we had a hybrid kind of a facility. Like we were using paper as at the same time we were using the electronic systems. But towards the end of COVID, by say right now, we are almost paperless. I think in another 6 to 12 months, we will be completely paperless. So what I wanted to say is COVID came like a boom, and we emerged in terms of telehealth, especially. Kuwait is a small nation, as you know. Half of the population is expats, and there are different languages, diversity, culture. It is very difficult to develop a telehealth system in Kuwait. But the plus point of Kuwait is according to the World Economic Forum, the Network Readiness Index showed that Kuwait is one among the 50 countries in the world, and the country ranked first in terms of mobile coverage and second in terms of mobile subscription and broadband, and one among the 10 in terms of household having personal computer. And the Kuwait improved the internet bandwidth per user, placed one among the 50th. When we are comparing with other countries. So these are the areas, the plus point of Kuwait. So I urge the government to release more fund towards the IT, especially the healthcare sector, the IT healthcare sector. If more funds come to the IT healthcare sector, We can develop the medical tourism. We pay, the Kuwait almost pays around 1.3 billion US dollars per year for sending patients outside. So if we develop the proper telehealth services, we can have online consultations prior to this travel, and we can reduce a lot of cost through this telehealth services. So in my concept, in another 6 to 12 months, we will be fully equipped, paperless, and telehealth will be emerging, and it will help the country to develop more apps for the patients and for the physicians, and we will be having more training sessions from different experts from the different part of the world, and we will be emerging equal to one among the 10 countries in the world. That is what we hope. Thank you very much, Dr. Alhuwail.
Thank you, Dr. Rajesh. So I wish I share the same optimism as you when it comes to Kuwait and how we can progress. However, as a scientist, I also have to be very direct and very frank. I think I agree with you, there is an issue when it comes to funding, but I also think there is an even more major issue when it comes to a vision, especially for the health informatics and how this is set up. I think we still have somewhat of a way to go, but I think we're lucky because we have our colleagues, who are joining us right here in the Gulf, and being as one, if you will, one body or one nation collaborating with each other. I think we can get there. So let me invite back Professor Syed, and maybe talk to us about the obstacles that you can see that potentially can delay the optimistic time frame that Dr. Rajesh had kindly suggested. What are the obstacles that for us to achieve and adopt telehealth services across Kuwait, across all specialties?
Yeah. Thanks, Dari. I think you have mentioned about a few already, the challenges that Kuwait is facing. From my observation, working in Kuwait for the past 6 years, and there were some projects that our students has carried out. I think the obstacles can be divided into two parts, from the patient perspective and also from the providers, the doctors, the policymakers. From the patient perspective, I think there are still issues of buy-in from the public whenever we want to run any telehealth program, because as we know that patients are still comfortable to come, and Kuwait is not a problem of transportation going to the clinics. There are so many facilities available. So even if you produce a very good telehealth materials, the access to that by patients may still be limited. That's number one. If we go to the next group, which is among the providers, there are a few areas that we need to probably improve. Number one, the content that within the telehealth application that need to be properly designed so that it will be user friendly to patients and also to those who want to use that. From public health perspective, the content would be a lot of it related to preventive services. How do we design and make a content that are very attractive to people? So this is very important aspect. And the other issues is regarding the staff that are going to be involved in managing telehealth. They must be trained, and they must be trained to manage the technical part, and they must also have another group of people that are trained to develop a good content regarding telehealth materials. And the other important aspect regarding technology is that people are always concerned about security of the materials of the system that is being developed. If the system is not secure and people do not trust it, then it will be difficult for us to get the buy-in from the public. So these are some of the issues, I think, the obstacles that probably Kuwait and maybe other countries as well have to think about when we want to go big on telehealth. Back to you, Dari.
Thank you, Professor. So with that said, Dr. James, if I can invite you back, right? So where could we look in terms, to and learn quickly, right? How other countries could approach this? I know Professor Syed had, suggested some wonderful suggestions, but where do we start to look?
So again, thank you very much for the question. And in the quality arena, we often talk about being inspired by what others have achieved. Again, it doesn't necessarily work everywhere. We have to think, that's a great idea. How does it work in our context? So it's always about look around, be inspired, learn, but adapt to the context that's relevant to us. Sometimes you hear this described as steal shamelessly in the quality arena. And I will always say, well, yes, steal shamelessly, but make sure you acknowledge where you stole it from. So, be gracious about it. Professor Abu Samra gave, as I said earlier, and you all saw the overview from Qatar. And I'm sure that we could take similar experts from all of our countries to share in the same way. And I think part of it is bringing everybody together for these opportunities like today. If I think back to my UK general practitioner days, we've been doing telephone consultations for years. In that time, I don't recall there was anything specific about how we managed that. We just applied the standards and the policies that we had. Obviously, in the UK, the doctors are regulated by the General Medical Council. I do know, since my days in practice there, they have issued guidance on telemedicine. And for those who are providing telehealth, they actually have a registration process. So there's some level of oversight. If we look around the world, some countries produce guidelines. Some of them are standardized and related to good medical practice, or they link to regulations. And countries like Australia, Canada, New Zealand are good examples. If we take France, they've implemented legislation. And again, I think it's for everybody to think, what do we actually need in our context? Is it guidance, regulations, legislation? How does it link into current medical practice and other requirements? When we look to the United States, a lot of the telehealth guidance and requirements are relating to how they deal with reimbursement. The cost of a telehealth consultation is most likely less than an in-person consultation. So how do they address that? I'm also thinking about specific licensing for telehealth delivery, the privileging of doctors. So for example, as I say, in the UK, the GMC requirements of good medical practice applied in any context, whereas others have actually applied specific legislation or guidance to telehealth. Another area I would think is worth looking into is how do we deal with cross-border telehealth? I'm currently based in Qatar. Theoretically, I could be delivering telehealth to the UK. So how do we regulate that? And look to bodies such as the Joint Commission. What have they done? What do they advise? And what might they start looking for in the standards? I'm sure the standards are due to be updated and will reflect telehealth. So I think there's a lot out there and there's a lot we can learn very, very quickly. But starting with ourselves, let's look to ourselves and see what we can learn from each other. Thank you.
Great. Thank you, Dr. James. And now if I can invite Dr. Samar to really also, you gave us a fantastic overview of what's been happening in Saudi Arabia, but maybe also looking and hopefully not stealing shamelessly, but hopefully acknowledging what other lessons have been learned from around the globe and around the world when it comes to telehealth standards and policies that we can adopt or look to. Dr. Samar, I think you're on mute.
Okay, thank you for your question. And I think it is a promising and a challenging issue around the world to the wide application and the wide use of telehealth policies across the world in terms of 2 points. The first one is the limited resources across different areas of the world, at the availability and the cost of internet and the related to telehealth, even the culture of the different population. So I think it's very challenging. The second point regarding the safety and security measurement across different countries, to if they can share their informations and their telehealth at a global level. Also, this important and challenging, but telehealth has achieved a great achievement in certain areas as regard the organ transplantation across the world, the international healthcare system regulations and the standard. So now we can put a benchmark to decrease the cost across different areas. If I have a complicated case, I can virtually consult a great professor, a great team from UK, from USA, from different areas of the world. We can. It has a great input. As regard the putting international standardization, the duration of different, the duration and the cost, and per se the latest report in UK reported that in USA the telehealth use decreased the expenditure of healthcare services around more than 30%, which means more than millions of dollars, which is a very important input. We already had felt the importance of telemedicine and telehealth use in the application of this vaccination transportation across the world. The WHO reporting a number of cases of COVID and eradicated the disease, and the important overwhelming surveillance system across the world. It gives us the telehealth in terms of regular and rapid reporting. It's give us an amazing outcome during the COVID pandemic. Even the international classification of disease during COVID, we have known that the pandemic launched by the application of the telemedicine and telehealth, and it's continuously changing criteria and the management protocol. Finally, in sharing the guideline and in sharing the standard treatment and the online training of physician gave us a great impact. Human right and human research ethics that applied continuously. I have a case in certain country and I follow up and I can consult another one. So I think also it's challenging. But during the COVID and the sharp rules restrictions gave us a spot of light that it will be we will, by changing the culture and providing the more investment, which is already done in WHO, started to through the telehealth and its continuous supervision across different areas in the world. They can provide fund, provide teams to train. So we wishing this great investment will go on and to get a great outcome and get benefit from the world. The world is a small country, so all of us can get benefit from each other through this great investment.
Great, thank you. And if I can invite Dr. Rajesh now, considering that there are many lessons that we can learn from around the world. Also, we come from different backgrounds. I know, especially in Kuwait, and I hope you can agree with me, that even in our clinical teams, the frontliners, they come from all sorts of training, schools of thought. Even they've been trained in different and various medical and health schools, right? Which have their own sort of way of teaching. So do you see this as a motivator or an enabler for adopting telehealth solution, having this diversity, or is it creating issues? What are your thoughts on this?
No, especially when we introduce a new software or a new app, the main issues are half of the staff will be accepting that readily and half will be very difficult to accept it. So this problem is universal. It's not only Kuwait, it's everywhere. So it will take some time to get adapted to the new system, and slowly over a period of time, everyone will embrace the paperless mode and the telehealth and other resources. The only thing I urge always is there should be a user-friendly app or software or whatever, because that is a major thing. A patient is sitting and you are wasting time on computer. It doesn't look like you are sitting in a doctor's office. So if it is user friendly, within a few seconds or few minutes we can finish it, and we can interact with the patient. So otherwise the patient will be sitting and we will be typing or doing something in the it doesn't look like the old, the system we follow. So the techies should think over it and how we can make it so quick so that the patient will feel the communication between the patient and that there I wanted to take the US Medicare system where it is patient centric. The doctor will get salary according to the comments or according to the patient satisfaction. So if that comes everywhere, automatically, it will be more patient centric and we'll be adapting. We can always adapt the hybrid kind of a system. I don't know how much it is practical. Maybe we can have some quick notes, and once the patient is out, you can fill it to the system, or I don't know how much it is practical. And in Kuwait, there is one more thing: is a few apps are in Arabic, and for example, I cannot read Arabic, but I can a little bit speak Arabic, and I can understand a little bit Arabic. So, but some app is totally in Arabic. So there we will face some issues, and it can be solved. Because just this translate mode is always there. And another thing is the coordination between different departments. Especially in the healthcare, we have different departments, and the coordination still in the initial phase. Probably soon we'll be having a coordination between all the departments so that it will be easy to deliver the proper patient care. And that is the only thing which I wanted to raise up in terms of physician to patient ratio. We are one among the best. I think around 5 to 8 doctors per 1,000 and 8 to 12 nurses per 1,000 patients. And I think this is one among the best in the Middle East. That's it.
Great. Thank you, Dr. Rajesh. Very, very insightful thoughts there. And I'm going to give my speakers the warning. I'm going to ask you the last question, right? And but prior to that, so that you're prepared, I will provide a summary to all the attendees of sort of the main highlights about what we talked about. But my question, so you can think about it, is in one word. What would you like to leave us with? And literally, I mean one word. So for all the participants, it was a great pleasure, moderating this session. We talked a lot about the importance of co-design, and co-design does not only include the physicians, but everybody in the healthcare process or the healthcare team, including the patients and their families. We need to really pay attention to the interaction, the design, not only of the software, but also of the space, right? So it's not super awkward when we're in the room with the clinician trying to get care. Trust and human connections need to be built. We need to focus on quality and safety. The usability of the content and technology need to be accessible and easy. We need to have new skills and educate both our staff as well as our consumers and their families. Cybersecurity and privacy, that's a whole can of worms, but we'll leave that at that. And we need to focus on providing value healthcare. So now, I'd like to ask my fantastic panelists for their one word. Professor Syed?
Yeah, my one word would be efficiency. I want to have an efficient telehealth system.
Thank you. Dr. James?
Person-centered. It's hyphenated, so it counts as one word.
Perfect. Thank you. Dr. Samar?
Invest.
Invest. Excellent. Dr. Rajesh?
Blockchain technology.
Blockchain. 2 words, but we'll let that slide. Thank you very much. It was a great pleasure. And back to the host. Thank you. Thank you all.
Thank you very much.
Thank you very much.
Thank you.
Thank you, one and all. Thank you very much, our eminent panel members, Professor Amer, Dr. Laughton, Dr. Aljunid, Dr. Rajan, and our eminent panel moderator, Dr. Alhuwail, for the interactive and extremely insightful panel discussion. It was indeed a very delightful experience to hear all of you speak and share your immense knowledge with us today. Thank you once again for giving us your precious time for the summit, and I hope all of you have a great rest of the day and a lovely day ahead. Thank you.